Okay, so what I'm gonna have you do is grab a wall. I'll show you how to do these on the floor as well, or just standing any time of day. But for the first variation and the easiest variation, just grab a wall. So what you're gonna do is you're gonna touch your butt, touch your upper back, and you're actually gonna use your hands interlaced or layered like this, because sometimes you can squish your fingers and it's not the greatest feeling. You're gonna have them behind you, butt, upper back, hands here. I'm gonna put this arm down just so you can actually see what's going on. And what I'm gonna have you do is take your chin and kind of look just a hair down, and then you're gonna retract this way. I want you to picture the curve in your neck basically becoming straight. And what you're essentially going to do is use that very small motion to lift your upper back and your butt off of the wall. So again, have your hands over like that. But for the purpose of demonstration, you're going to slightly retract and then just relax. Touch, touch, touch. You're going to tuck the chin, pull the head back, and hold. Come out. And then you're going to do it again. Tuck the chin, pull the head back, and down. If that's too easy, then what you're going to do is take a little baby step. Same thing, butt, upper back, hand. Retract a little bit, and then go ahead and relax. You do it once more. But this time you're actually going to lift your entire body off the wall using your neck. So, chin in, head back, hold, come out, in, out, in, out. I want you to do these for 2 to 4 sets of 10. And the other option, if you don't find that that's helping, is a static hold. So either half step forward or wherever you need to be, touch, 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 and hold. You also don't have to use your hands, it just creates a little extra space. I personally don't do it when my headaches act up and my traps are getting angry from sitting all the time. My personal favorite variation for myself, again, everybody's different, is just here. But as powerlifters, we're gonna have super duper strong necks, and you'll see that we have those thick necks. It's kind of a strange look. But my other favorite variation that you can do is just without a wall. And this is nice. This one's nice because you can actually grade the exposure to the force. So I'm gonna kneel just because it's gonna be a little more stable for the video. What you're gonna do is the same thing. Oh, there's a mirror here. But you're gonna interlace your hands. And back here, again, slightly retract and then relax. The whole point of the retraction and relaxation rather, is you don't want to be elevated and you don't want to be super depressed. So just retract, kind of puff that chest out, and then relax that. And you're gonna go ahead and create some force with your hands, as if you're pushing in this direction against your head. And it's gonna look like that. Tuck the chin, pull it back as far as you can. And these are better for isometric holds, so maybe count 10, 20, 30, really gotta work your way up. Count to 10, come on out. Count to 10, come on out. And if you are the kind of person who has little aches and pains back here, especially if you like poke them, hit the trigger points, and they just light up, the pain would be local in the area, it shouldn't travel anywhere. Then you might actually benefit from doing this part, but also kind of scooping up with your hands, like a there. It's actually part of your hands, just to get some length in there. It's a good way to add it. The other thing you can try is, and I actually have not found a lot of success with this one, nor has a lot of the people I've talked about who have used this, but it's the same variation, literally the same thing, just on the floor. And because everybody's different, it's worth trying all of them. So, you're big, strong, and jacked, so your upper back is going to be most likely too thick, front to back. So there's really nowhere for your head to go. Like mine barely can go anywhere. This is ineffective for me. So again, you can interlace your hands or use a firm, not hard, but a firm surface. Maybe even a couple pillows should do the trick as well. I'm not going to use this hand just so you can see in the video. But here, some sort of elevated but firm surface, and you're just going to press it back, and your chest and your upper back might rise off of the ground, and that means that you're doing it well too. So retract the shoulder blades, relax, tuck the chin, bring her back. Once more. And last one. I personally don't feel those. You might, so give it a try. And the last part that I wanted to show you for your own self is, because we sit a lot, we're here, we're stuck here, we're bench shoulders, 9 yards, we've talked about that a million times. But one of the things you can always do is, well, there's two really. So the first one is you can just poke around where it's hard. You can use a pincer grip kind of and just find that nodule that's just not the most there it is. Okay, there's one for me. So I have one right here. You can pinch it and just breathe into the belly, relax. The other part is you can use a broad contact. When you're at the gym, you can use a bar, or if you have a partner, then you can always have them do this as well. And what you do is you press on it, and it's kind of important to do this particular sequence in a certain sequence. So what the traps do is it pulls your head contralaterally. So this is the reference side, my right side. It's going to pull my head to the left. So you're going to go ahead and do the opposite, right? So you're going to have to press on it with your broad contact, look towards it, bend the head away, and then come back. Press on it, look towards, bend it away, and then you might get some head down action too that might pull right where you need it to, but not always. It very much depends on where along the chain the trigger point is. And the other variation, this is my personal favorite, is just take your arm, prop it over, kind of lock it into place, and use your arm to push your head this way, and then take this hand. That's what I'm talking. That sucks. This one you're going to pull like in a direction so you're looking away, but then also go ahead and try looking towards and pulling down. This one you really want to pull down. I'm actually not feeling a stretch looking towards, so I am going to look away. And conceptually that doesn't make sense, but we're going for sensation, not so much like perfect anatomical stuff. And then while you're at it, you can always just toss a thumb right in the unhappy spot. And this is what you'll see me do a couple times a day throughout the day. I may as well get the other side over here. So while we're doing the other side, same setup, hand behind the head, get your thumb ready, find that anger spot, look away, head to the side, a little bit of down action, and there it is. So when you're doing this, deep breaths like we always talk about, and the last part is going to be, you can do these for 1 to 3 sets. Usually one set is pretty intense, so I personally call it at 1 set, but 1 set of 10 contractions, right? Well, not contractions, but movements. And it can be done in rep work, or my personal favorite is you're gonna do the thing, and then you actually kind of resist against this hand. So this hand's pulling this way a little bit. It's only like 5%. And then you're using your head to push against and push back, but only about 5% of what you could do. Very, very light contraction. And you're gonna hold it until you start feeling something in here, start to chillax. It might reproduce the headache. You might get another pattern. That's okay. It's gonna suck. Let it happen. Breathe your way through it, and with time, it should start hurting less and less, and that's when you can stop. So just to recap, we have a couple movements. We can do it against the wall with our hands and tuck. We can do reps, like we talked about, or we can do the static hold. You can also do it with just your hands, like I just showed you, and then the other one is you can do it on the floor as well. If none of these work, then I can show you one last thing, but it will require a partner, which means it's not something you're gonna be able to do all the time. But worst case scenario, I'll make another detailed video on that because it is kind of specific. But between those and what I'm writing up for your programming, I believe we'll be able to help. Please reference the video called Wave Breathing and Bracing. That is gonna help facilitate everything. So let me know how this goes.